The CDC says COVID cases are on the rise across the U.S., with almost every state reporting a spike in new infections as we head into another holiday travel weekend. At least 22 states are reporting very high COVID-19 wastewater levels. Most of those states are in the Midwest, Mid-Atlantic, and New England. Dr. William Schaffner joins us now from Nashville. He's a professor of infectious diseases at Vanderbilt University Medical Center and always helps navigate the fiction from the facts. We're glad to have you with us, Dr. Schaffner. So there's this new coronavirus strain. It's emerged in recent weeks, JN.1. The World Health Organization has called it a variant of interest. What do we know about it? How concerned should we actually be?
Well, Lana, it's good to be with you. And it is indeed winter respiratory virus season. And COVID is out there surging, as you were just saying, across the country. It's certainly happening in my neck of the woods here. This new strain, which is a subvariant of Omicron, you can think of it as a grandchild of Omicron, shares some characteristics with Omicron. It's very highly contagious. It seems to be outrunning some of the other variants and becoming dominant. But there are two good things about it. One, it's not producing more severe disease. And number two, the laboratory studies would indicate that our currently updated COVID vaccine does provide protection against severe disease caused by this variant. And that's very, very good. Now, these vaccines will not provide excellent protection against milder disease. And by milder, what we mean is not needing hospitalizations, but you could be kind of miserable for 3 or 4 days. But protection against hospitalization, intensive care unit admission, protection against dying. What's wrong with that?
Sounds like things that people should pay attention to. But the country is no longer in a COVID emergency, Dr. Schaffner. So a lot of people don't really feel that concerned about it. They're viewing it more like a cold, like a common cold or the flu. Is that an appropriate response? It may very well be. And remind us how long those boosters actually last, if people are sort of wondering whether they need to get boosted again.
Well, remember, Lana, I talked about the respiratory viruses. And so we need to respect these viruses. Influenza, which is also surging across the country at the moment, and we've underutilized that vaccine. COVID is increasing, and RSV has increased, and fortunately, may be plateauing in many parts of the country now. But these viruses are out and about. We have vaccines available against all three of them, and we ought to take advantage of them, respect them, because these viruses, highly contagious, can put even healthy people in an intensive care unit within 48 hours. So we need to respect them, and we want to make this holiday season as safe as possible for ourselves, our families, and our neighbors. It's the best present that you can give. These vaccines, particularly the COVID vaccine, will provide protection for the next 4 to 6 months or longer. The younger and healthier you are, the longer the protection you get.
You mentioned there flu and RSV. RSV in particular, we've seen surging. How do you tell the difference between these different infections, and what should you be looking out for if you're concerned? The difference between sort of standard, it's the winter and people get sick, and where we actually need to be concerned.
Well, it's very hard to distinguish these viruses clinically. Even we expert infectious disease doctors often cannot do that. You need to be tested. And here I'm going to emphasize, Lana, people who are at increased risk of these serious infections: older persons, people with underlying illnesses, heart disease, lung disease, diabetes, any kind of chronic illness, persons who are pregnant, persons who are immune compromised. If you get sick, please contact your healthcare provider, get testing, because particularly for flu and for COVID, we have medications that can make the illness less serious. And all of us, in addition to getting vaccinated, if we go out into crowds, indoors, get your mask out again. It provides an additional layer of protection.
Also keeps you warm outside, I've noticed. All right, Dr. William Schaffner, thank you.
My pleasure.